So I think there's a few things that would be worth chatting about.
Where are we at, Whip?
We're in Saskatchewan.
Saskatchewan. So this is deja vu to our 2022 episode, but no, this year we're actually in a new province.
We're in a new province,
British Columbia, and this I understand, I've heard from a secret source, is a city and a province that's near and dear to your very creation, or at least delivery into this world.
Yeah, probably the delivery. I don't think it was the creation. I did not ask my parents where they were 9 months before I was born. I do not have that information.
Fair enough.
But I was born in Victoria, BC. And we have a few pictures of me somewhere around here.
Yes.
You know, I remember this like blue little jumpsuit. I remember the picture of it, and then seeing my parents looking like young and healthy and
great,
ready to live. Yeah, so I like Victoria a lot, and I like it a lot because the weather is just milder than it is where we live, and the outdoor stuff when the clouds are away. It's very nice.
Energy. Nice. So we're at the CSAM conference 2023, CSAM 2023, as they say.
Yeah.
Which is the Canadian Society of Addiction Medicine.
Yeah. Crisis in caring in crisis.
Yes, I see how they did that double entendre by just flipping the words.
Yeah. And I don't know if you remember that's what I was suggesting they do.
You don't remember? Aren't they your words?
They were. Well, we had a wordplay thing where we're just like throwing out random ideas. What do you want to call it? What do you want to call it?
Now I'm trying to remember. Was it actually your idea, or is it because you fed the idea to me and then I presented it that's how it got picked?
I don't know. I have no idea.
I mean, you could say that sometimes when the idea comes out of my lips, they tend to go with it because, hey, it's a lived experience guy. He must know what he's talking about.
Well, I don't know about that. I think you also have very good. You have ways of communicating in meetings that are highly effective, right? And if some people do go online to see the videos of it, if they ever are posted, I do think the CSAM, there was this involuntary discussion chat that you moderated. And you were literally like a host, like you looked like but it was like a host / interviewer, right?
Yeah.
In it, you took on sort of both of those roles, like a moderator, but also like who? There must be some guy that does like article or does like interviews when they ask you a couple of tough questions, like no.
Yeah, I don't know. Yeah, I don't know. I kind of got my footing with it. I mean, two great guys, right? So it was two very well respected psychiatrists in your field, our field. Dave Crawford and Rob Tangay, right? So
yeah, and it was one of the sessions. I think a few years back at CSAM, we had these like planning meetings trying to figure what is sort of the vision, what is the direction, and I think one thing was it's always been a part of physician education, and it's also been a part of certification sort of separately. And then they talked about, well, should it just be physician education? Should we be more inclusive? Should we? And then they changed who the voting members are and who can be on it. They also started to have more sort of skill-based things. But the thing that came up that I was happy that they did today, although we do need to do it better, is how to have some of these difficult conversations, right? And because there's a lot of controversy in some areas of substance use healthcare, and they can get quite intense at times. And why not have the conversation somewhere like here, right? Where you can bring in some of the data, bring in some of the science, bring in some of the opinions, bring some of the public policy people, stuff like that.
Yeah, definitely. I mean, so we had the public officer of health and I'm going to forget her name, but she was lovely for talking for Vancouver. I forget what it's called, but the public officer of health for the province.
The coastal island.
Yeah. Just maybe for the island.
Just for the island.
Just for the island. Okay. And she was
quite good. Yeah.
And she was talking about public health policy. And then we had our friend Alex Caudarella was there.
Yeah.
Speaking on a really kind of unifying message of kind of pulling people together and kind of taking the temperature out of the rhetoric that's on both sides. Well, not really.
He's the CEO of the Canadian Centre of Substance Use, and historically, last like 5-10 years, they've come up with great documents that really describe the data on different things, the harms of cannabis, harms of alcohol, things like that. And I think they're trying to not just have the information there for the general public, but also how to help healthcare providers and help patients once they're actually struggling with because it's a big difference, if you're a member of the general public and you might drink versus if you're drinking heavily and regularly, right? And I think the way I see the direction going is bringing more of the medical stuff in. So yeah, he was there and he gave a talk, but although I couldn't attend because there was something else there as well. They did a very good job of organizing this thing, I think. Jen Brash, she's a psychiatrist in Hamilton. She's the conference chair. And they found a way that almost at each time slot, there's like 3 or 4
Yes.
things that are of interest.
Yes.
You just can't pick which one to.
Yeah,
to see.
yeah. There was a lot. Well, that's right. So speaking of Alex's talk, I was able to catch that, but then I slipped into the talk that you were at, which was the lived experience talk, which Raj is. What does Raj do again? I'm sorry.
So Raj, right now, I think he's a family medicine resident, but he started being a part of our conference committee as a medical student at Calgary, and there in the committee, he's just like, look, doctors need to do a better job. He's like, I want to have a session where people with lived experience guide us on how to do it better. Yeah. And you were integral at both sessions, right? In terms of some of the questions, how to design it, how to set it up. And this year was so interesting because they had a local organization called the Umbrella Society.
Yes.
And wow.
Yeah, wow, right?
Wow. Like, oh my goodness.
Yeah.
Like you want peer support done right. You do it like Umbrella Society.
Yeah. And
oh my goodness.
They did an amazing job of it, and they had some great participants at it and very honest folks, and they're a really good team, and it's a real team though. I mean, that's the difference.
I think that's the difference. It's not like it's one person who's hired, and but it's just it's a group of people. They've done it for a while. They know how to support each other, train each other. That one line, I was like, oh my goodness. He's like, it's like not like you're a peer. You can graduate to a real job. You've got a real job. And I was like, oh my goodness. It's like sometimes you just need someone to speak the truth, right? Sometimes you just need someone to speak the truth, and they've done it in a way. And I don't know if you can create what they've had within a traditional healthcare organization. It almost like it had to be separate, right? Because there's so many not artificial, but there's so many rules around who you can hire to do what, to do this. You can't co-create. You have to fit a square in a peg, whatever the metaphor is.
Right. I'm going to do up my fly as we're halfway through the interview here. Yeah. I think, and it kind of, and
should we start over?
No, we're definitely not starting over. I think it also underlined an important point though, and not to be like Debbie Downer on this or whatever, but and they obviously nailed it, right? The Umbrella Society absolutely nailed it. So full stop, good for them, what they did. But what ends up happening, and as somebody who was originally hired by an outside agency, but then what happens is you get this scenario where there's kind of two classes of employees. So you're going to have one of those outside agencies working with an admin, perhaps in the whatever department there is, and they're talking about, my optical benefit went from $300 to $275 this year or something, right? And they're talking in front of the person from the outside agency who doesn't have any benefits at all, right? So it's that you got kind of two classes of employees. The girl sitting at the desk or the guy sitting at the desk is getting 7 weeks vacation or something because they've been there for 8 years, and this person's getting 6% added to their check, and that's what they're getting.
Yeah, I mean, this does get tricky because these inequities are there in every single team, right? So like the doctor is going to be paid different than the social worker, is paid different than the case manager, paid different than the admin, paid different than the nurse.
It's not that simple. It's about absolutely. There's all kinds of those sorts of things because but there's reasons for every one of those different explanations. But I'm talking about two people that have worked inside that same hospital for the same number of days, the same number of hours, and everything else. And perhaps even it's not a rate of pay issue. I'm not talking about a rate of pay. I'm just talking about as somebody, in fairness, doctors don't get any of this stuff. So it's not really an issue you guys deal with. But all those other things are important to people that are surviving, right?
I just think what they have is better than what's currently happening.
Who?
Right, the Umbrella Society, the way they run is better than what's currently happening. And the reason that I say it is that they have a central hub, whatever that means. Yeah. They have weekly sessions, weekly debriefing. They got all the different. But I'm saying
they got all the support. I get it.
There's nothing like that if you hire 2 peers or 5 peers to be part of your team in a one organization.
Absolutely not. I'm just saying from the just playing devil's advocate of it, and as I've worked with people that have worked inside our hospital from other agencies, and that's what often.
But I would also probably not design it so it's like. But I guess you have to design it so it's a hospital specific position. It's not like you can have a group of people that'll help different organizations. It's better to have them at one spot.
Well, no, I mean they do. I think that's why Umbrella Society sounds great. They're kind of
a central hub,
they do
and
it all.
They can send some people to RAM clinics.
It's absolutely amazing.
Outreach, and then there's room for lateral movement within the organization, right?
Absolutely.
So you can move from a RAM to a hospital.
Sure. Yeah. No, it works. It works, right? It's just I'm.
There's still a divide.
Well, there is a divide,
You'd
right?
rather graduate to in a hospital job.
Well, yes, but not everyone's ready to do that. I'm just saying if you're at that stage of being a full-time employee, even in Toronto, we're dealing with this now, right? So as one of the other places I work is Fife House. I just recently got on the board of directors of Fife House, and one of our challenges right now is our actual staff that work for us at Fife House get paid X dollars an hour, let's say, in the exact same role working for the city of Toronto or the province of Ontario. They get paid 15% more than what we pay them. Now, that's not our choice. Who pays and who's funding us? Oh, the province and the city of Toronto. Oh. So they fund their own staff at different levels than the hospital staff or what they will fund a charity.
Yeah, I know that's actually true, because I was talking to some social workers who are saying you get a hospital job, you get paid a lot better than a community job.
Yeah.
Same social work. Yeah,
and then you put that, but it gets worse because then you put that same person inside that hospital and then they get paid at a different rate. So if a hospital hires a peer, they will get paid X dollars. And if a charity hires a peer, or a charity, I got the right word, yes, a community organization, they unfortunately are paying at a lesser rate because that's what the government funds them at. It's not the charities making a profit.
I mean, it's so tough because the inequities are there anywhere you dive deep into.
Right, but full stop, absolutely. The Umbrella Society. I mean, I've never seen a better organization.
I think, I mean, I would love to just take their model, or even have them like coach and have expansion, like have Umbrella Toronto or have Umbrella. Whatever.
Well, that's a lot of what, the St. Stephen's, which is now the neighborhood group, which Nadia, Nadia. She's great. And that is our equivalent.
But that's the model.
That's what they're doing. So they're sending it. So I thought it wasn't your hospital, it's UHN. So they've got a whole peer program at UHN. Yeah. So they bring peers into there. So, and you know what, I'm just looking at it from perhaps a completely different lens, because I'm one of the very fortunate few that was able to, work full time, because I used to work full time. A lot of people never worked at all. So, so I always look at it from a, next angle.
Stuff, right? You're looking from the peer angle, whereas I'm looking at it more from a organization angle, where how do we get them to join our team? And you're thinking that if I was a peer, this is what I would go through, this is what it would be like, this make it easy, this make it difficult.
Right. And if you hired the person, unfortunately, in these organizations, as we've seen, if you don't have the support for those people, they're not going to be able to stick around. And even worse, they may have poor outcomes on their health too, which is a bad thing, right? We don't want to have that happen.
Yeah. And then that's why I almost like the idea of a separate organization that's for us, about us, whatever the expression is.
Nothing about us without us.
Yeah, and well, it's designed by peers for people, like it just and then also have a structure that like, for example, if you were to hire one peer solo and then they get unwell, you have no idea what it takes for them to get better, right? Whereas if they're part of an organization that's very familiar with 100%. It, at least then the person's away, but maybe the person's away because they put the person somewhere else. Maybe you don't have to assume, right?
100%. And they're well supported. It's part of a community. It couldn't get any better than that.
Because when we worked with when I worked with peers, when I worked with you and the team there, I couldn't advocate for anything. I was like, we need weekly meetings. We need like daily check-ins and debriefs. We need I couldn't get any of that. And the answer really was, well, there's a monthly call with people around the province that can support people. And I was, well, how many people are there? Like, about 40, 80. And I'm just like, I don't know if that's what. But the thing is, at the end of the day, there's only a certain area that we have purview over. Yeah. And at the end of the day, while I'd love to have a peer, I wouldn't want to work with a peer that was under-supported. I'd want to find a way to make sure that whatever you set up can be doable and sustainable, right? So. Yeah. So that was it. I mean,
you've only adopted one peer in your life. See how draining that's been.
Yeah, if you want to use that metaphor, sure. But the talk was really well done, and so there's 3 people that were there. I worry a bit that we may have made them share too much. That's the part I was a bit nervous about in the beginning. And I think should make it clear that you don't have to share your story if you don't want to. Yeah. Right. Like you're here to help us. If you want to share your story, you can. Yeah. And you're here to help us do better. Right. So.
Yeah, and I think that we need to do work on that language too, because even as you say it, sorry to call you on it, but we don't want you to share your story, but tell us what it was like as a patient in the hospital.
Yeah, I wouldn't have asked that question. Although I reviewed the questions, right?
I
You
think you
reviewed the
did.
questions, I reviewed the questions. Yeah, I would not have asked those questions.
Yeah, so it was tough. So we still need to do our work, but I think what was so amazing is that event was so well. There was standing room only. People were standing and sitting in the back row.
I mean, it wasn't like so phenomenal. There's probably about like 40 people there. Do you think?
I don't know if there was. I'm going to tell
80 people?
Maybe there was 80, maybe there was 40, but what I'm going to tell you is there was twice the amount of people in that room as there was in the lecture hall.
Yeah. Oh, but that's a organizer thing, right? But you can't predict where people go, I guess,
Why is it an organizer?
Oh, because they could have put us in.
Yes, maybe. And instead of one microphone being shared for 22 people in the lecture hall, we had 6 people had their own microphone.
Yeah.
And our own AV guy. And I mean, this, I think.
But we wouldn't want this recorded, right? So all the ones in the lecture hall were recorded.
No, tomorrow's not going to be recorded.
Okay, never mind. Well, I mean, the thing
I'm not saying, but I think this is a message for next year. Yeah. Next year, this is an important event. It was a very well received event last year too.
I think the good thing about the way that you think is you always want things to get better.
Sure.
And you notice those things, which is great.
Yeah. It's an evolving process, but yeah, Roger did an amazing job and got some amazing folks in there that really shared.
I hope they continue it. I hope I hope they highlight these local organizations wherever CSAM is. And I hope that the people that attend, are treated fairly and treated as people, and they get something out of it too, right?
Yeah, absolutely. And we got to watch the premiere of Chris Cull's video last night. A very powerful narrative, really well produced. It was, I really enjoyed it, and Chris is a great guy.
It's fantastic.
It was a little hard to watch at times, but
I mean, that's the thing. I find these stories really intense. And I don't know, like it's one thing, when you're at your work and you do your job, you do your assessment, you still try to be as human as possible. But when people tell their personal stories, it's like floods. It's like floods of tears. Even in the lived experience story, I was like feeling it, because it's just there's something where when you don't have your work hat on, these stories just I don't know. It's oh God, you're making me remember part of it now. Like,
no, I mean it is tough though.
You have to. You almost have to have like your robot brain on, to get some of the content.
Yeah.
Because the depths of suffering that people experience is just it's even hard to imagine. Like some of these like prose and literature that's describing darkness and despair sometimes doesn't capture the suffering that people have. But I'm so glad that it was put out there, and it is a story of survival and growth, and I liked how he wanted different voices. So it's not just me. It's not just my story. My story is a part of it, and there's other voices as well.
Yeah, actually, well, he's developed. I didn't know it was a series. So it's a series of 6 or 8 episodes, and he's planning on continuing it on. I think beyond that, and of completely different people sharing their stories.
Oh, fantastic! Good for
him. I mean, it's well, it sounds a little bit like our good friend in Saskatoon there too, a little like the Hard Knocks, bringing that his stories forward, which he's done built such a great platform doing that. Daniel Unmanageable, I think he has a different last name. Hard Knocks Talks, yeah. Okay, so so that was our CSAM experience so far. Thanks for watching. If you like what you saw, please feel free to like and subscribe. That way you'll get notified when we come out with new content. We try to come out with new content about every week or so. So anyway, thanks again and see you soon.